I'll give you a little splash of what Pitt Dental Medicine is doing to address the workforce issues across the Commonwealth, and hopefully I can get my point across about how unique, creative, sustainable, and scalable our model is. So it's something very different. I was saying in the back to Nicole, it's kind of like a Goldilocks sort of moment, very intentional the way we put things together, so you can let me know what you think. So, I don't need to tell this group this kind of stuff, but really I felt like I had to put some things in here. This 1/3 of the dental auxiliaries retiring in the next year from the ADA for Marco Vucevic is compelling, right? If we're suffering now the way we are, what are we going to see 3 to 4 years from now? Of course, our rural population dentists are so declining, and the uniqueness for the Commonwealth, of course, is that that's across the majority of the Commonwealth. So to take a small fraction of our workforce of dentists and dental hygienists and imagine that they can actually cover, in 2021, and it's worse now, 48 counties is hard to believe. But here's part of the point I'd like to make today to you, is that I think many of the people in this room, myself included, I grew up in a rural area, Mountaintop, Pennsylvania, in Luzerne County. I say, we heated our house with wood, and people said, you didn't have any electricity? And I said, oh, we definitely had electric heat, we just weren't allowed to turn it on. We couldn't afford it. So, spent a lot of time splitting wood over my head with a sledgehammer. But do I love rural areas? Of course. Do I feel committed to rural areas? Yes. And what we have done in the past, not to discredit in any way, I don't want to be misinterpreted for discrediting incentive programs. I'm happy we have them. But those incentive programs certainly promise, go to the rural areas, they're beautiful. You'll have work-life balance. You'll really connect with your community and do impactful work. That's not, BS, that's true. Right? You raise your families there, wonderful. And there are these incentive programs that include loan repayment to get them to go there. I recently asked a group of my peer deans, and I think Mark Wolf was there in August in Canada, and I said, tell me about what you're getting, what's succeeding in these incentive programs. And I heard the opposite from the deans. I heard one dean say, I have $1 million to give away every year. 100 grand scholarships every year, and I can't get rid of them. I heard another one say, I can get a contract for a new graduate to stay in a rural area for a certain period of time. They end up taking me to court to get out of the contract. So I don't need to tell this group, right? If you're not connected or experienced or in some way attached to a rural area, the likelihood that you would go to the big city, if you will, and then go back to the rural area are slim. I'm a good example of that, and not only for the reason that I married a Pittsburgh boy, and it's a whole nother topic. Pittsburgh people don't leave Pittsburgh at all. I mean, we left for military orders, but that was it. So yeah, we've been selling this over and over again, and again, they're good programs for those who want them, and I'm glad that the people that they match with, I'm glad that they have these programs. But the reality is that, in essence, they're leaving those regions. And we aren't getting people to stay. If we were, we wouldn't be here today, right? So we keep doing it, and we stand here and say, why isn't this working? How come we're not getting ahead? So for me, the very Goldilocks moment was to come up with a program that has 3 pillars in it to be just right, just the right size and just the right amount of education and programming. So for us, we call these our regional training centers. They are very focused in rural areas. So they are a general practice residency program. By design, if I can't get 3, and there's going to be 3 in there, and I believe the success of having a GPR in a rural area is that your goals align. I mean, I went into the military to get better comprehensive care experience in dentistry. What I propose here is a 1-year time frame for those new graduates to get highly trained in comprehensive dentistry. And by the way, the goal aligns because what's needed there? comprehensive dentistry, and a lot of it. So if they leave after year 1, my program does not break in any way or suffer. Do I want them to stay? Of course. But if they don't, the program will be sustainable. A dental hygiene program. 5 of those, then again, Goldilocks, 5 students in each rural training center, regional training center. These individuals, after a year of prereqs, in a 2-year dental hygiene program can have an accelerated bachelor's degree. So something really to offer someone in a rural area. A dental assistant training program. We'll have 12 of those in each regional training center. I'm just going to start calling them RTCs. And they'll, of course, come straight out of high school. A lot to offer. We're hearing a lot about, I never really thought I could consider a career in healthcare. And in fact, one of our trainees in our pilot program actually was living in her car with her mom. You know, I mean, just a new opportunity and a new career opportunity for them. So here's how it works. All of the programs will receive hybrid education, meaning their didactic courses will be online. We're used to doing that thanks to COVID, and we have some amazing faculty at Pitt Dental Medicine that are committed to providing that. And they do that already for our dental assisting program, which has taken off. Of course, they can't learn clinical experience online. They're going to do that in person with real live patients. Dental hygienists, by the way, will do some simulation activity, just like you would expect, transition into patient care, live patient care. And the big kicker for us is that we aim to recruit from those rural areas. So we will recruit from there and have them train there and not have them leave that area, hopefully keeping the workforce in that area. Train where you live. So here's what the model looks like on an educational side. Pitt Dental Medicine, again, is going to provide that, those didactic models and train them virtually. Our hospital partner is going to provide the on-site, obviously, location for the GPR residents, and a nearby federally qualified health center partner is going to provide the clinical locations for the students and the GPR residents who are not on hospital, when they're not on hospital rotations. That FQHC partner area, of course, will have some faculty there from our school, so full-time faculty. Here's where it really gets exciting. The partnership of this is something I think very unique. The hospital partner is going to get a brand new revenue stream that they desperately could use in a rural hospital. They are going to get the GME funding, the general medical education funding, per resident rate, depending on what they negotiated, anywhere between $120,000 and $150,000 per resident. Brand new, to do nothing, just to get it. Plus, we're going to give them all the income back from the services rendered. The same will happen on the federally qualified health center side. Income from the procedures from everything that someone does in an RTC, they get to keep. And that includes our residents, our students, and our faculty. And why is that? Could I take a taste of that? Yeah, I could, but I think it's so important to me to stay in my lane and just collect tuition dollars. I'm an educational outfit. If I can help a rural FQHC and a rural hospital thrive, why wouldn't I want to do that? So moving forward, of course, we can look forward to some short and long-term patient and workforce outcomes. You can read them there. Obviously, we'll have more patient visits. We'll have more actual providers in the community. Access to care will certainly be improved. More complex dental treatments because these GPR residents are licensed dentists, so they're there for soup to nuts, not slow or like dental students can be. So hopefully they're at that skating stage. Hopefully our patients will begin to understand the benefit of improved oral hygiene, sustained dental workforce, decreasing dental disease, and impacting positively oral and, of course, overall health. And like I said, attracting students to healthcare careers that they previously thought unimaginable. To me, that falls into the changing lives category, not to be corny, but truthfully. Short-term benefits on the economic side, of course, like I mentioned, new revenue for both of my partners. I want them to win more than I will, truly. I do get some tuition for that. We obviously are pulling in some family-sustaining wages, some nice job opportunities for folks that choose to stay. More taxable income in the area, that always helps. Economic growth, obviously a benefit. I just read from CareQuest 2022, happened to have a pop-up in my phone that just came up in the last half hour, you know, $3.9 billion in ER costs, obviously for dental-related issues. What a cost savings that these rural hospitals can now have. And most importantly, hospital administrators don't quite realize this until you tell them, but when we make people in the region more dentally healthy, they're able to get the surgeries that not only the patients need and deserve, but the hospital administrators understand that then again, they can you know, see some income in that. So, the secret sauce, again, mutually beneficial relationships. That turnover is expected for the GPR residents, and we're training in the rural areas. And I just wanted to end with this slide, just to give you an idea that if you have, and you might be thinking, how much does a regional training center cost? I don't, you know, downplay what $1 million means, but they're $1 million a piece. But imagine if we invested $15 to $20 million, that in 1 year, we could see 75, and this is a very conservative amount of people, looking at like 5% or 75,000 to 100,000 people across many 15 to 20 regions and close to 400 providers. So I want to mind the time, and I believe I went over by a minute or two, so sorry about that. I know we were running behind from before, but if you want to learn more, you can contact us, and we'll look forward from hearing from you. Thanks. I think this, yeah.